Hi, my name's Nikki Raymond, and I'm the CEO here at Georgia Hope.
And I'm Tonya, Parrish Clinical Director.
So we really wanted to talk today about teletherapy. Teletherapy is not just a way to see somebody on a video. Teletherapy for us is a creative solution to a nationwide problem. We have a shortage of clinicians nationwide, and Georgia Hope is not immune to that. This is an answer for us. This is an answer. This is a blessing. This is a make-a-way core value, and yet another way miles don't matter. We have literally hundreds of clients awaiting a therapist, and this is a way to see them, finally. You know, I feel like Georgia Hope has historically been somewhat of a trailblazer when it comes to finding creative solutions to meet our clients where they are. When somebody on the state level references community-based mental health, they're really talking about non-inpatient services, right? So for a lot of your quasi-governmental entities, which we call CSBs, that means in-clinic services, in the community. Georgia Hope has taken community-based services to an entirely different level. We always have. It's who we are. We don't know how to do services only in a clinic. A clinic, that's not even recovery language. So 90% of what we do is in the community. And this is yet another way of providing community-based services. Tonya has actually experienced, this solution.
A practical, implication to teletherapy is really being able to meet the needs of our clients who sometimes can't travel to the office or, can't meet up with their kids at school for a reassessment. This is a way that we can bridge the gap between, traditional ways of therapy and really looking outside the box and being able to reach as many people as possible. I was just mentioning to someone today how one of my clients was a stay-at-home mom of 3 kids under the age of 5, and she took nap time to have therapy via teletherapy with me in a way where she couldn't have done that before, where she couldn't have left our children at home and gone to the office or brought somebody into her home while her kids were, running around or what have you. So, it was a big blessing for her to be able to have therapy via teletherapy. Miles don't matter anymore, and we can definitely reach more people, offer more access to services, and bring therapy to more people in rural areas who otherwise wouldn't get the service. And it's really a powerful tool that we have to reach more people in our communities. What this means for Georgia Hope staff is the biggest impact I've seen so far is we can follow our clients. So let's say there's a child in the foster care system or moving from mom's house to grandma's house. We don't have to change therapists. We can follow that child via teletherapy no matter where they live in the state of Georgia within our region. So it's really impacting just the overall clinical care that we can provide. For staff, that could mean also maybe they have a packed schedule one day, but somebody really needs a therapy session. They don't have the time to drive 45 minutes to the home, but they do have a 45-minute window at home that they could do a teletherapy session. And I think that's really important to give that ability to staff to be able to meet their clients where they're at and when they need it the most.
Just from a sort of mental, emotional weight, there is a heaviness that we in this field feel. These epidemically high rates of lack of clinicians. And, for a company filled with people who have so much compassion, it is difficult to separate out, we are doing the absolute best we can to meet the needs in the community from we can't. We simply cannot. We don't have the workforce to meet the need in the community. So now being able to say, boom, we have this answer. We can see you. We can make a difference in your lives. I mean, this is just groundbreaking. It's amazing. And it's, for our staff, an emotional, mental burden has been lifted for us, knowing we have a solution. Lucky are we that we get to continue to do what we do on an entirely different platform.
Yeah, where's your like?
I did. That's Nikki's favorite
Action!
part.
Okay. All right. Say your name, your position, name, position. Okay. Action.
Okay.